Unintended pregnancy? If you consider getting an abortion, here are your options. The first thing you should know is that you are not alone. Abortion is actually a pretty common procedure that is extremely safe. Each year, there are an estimated 73 million abortions worldwide. You might feel confused, but don't worry. We're here to help you. If you're considering having an abortion, make sure to choose a safe option. The World Health Organization, WHO, recognizes two types of abortion methods as safe. Medical abortion methods, with mifepristone and misoprostol combi pack, with misoprostol alone when mifepristone is not available. Surgical abortion methods, also called uterine evacuation or aspiration abortion. Manual vacuum aspiration, MVA, electric vacuum aspiration, EVA, dilation and evacuation, DNE. Medical abortion is a safe method used by women that consists of taking pills to induce abortion. There are two ways of doing so: taking a combination of two medications, misoprostol and mifepristone, or only one, misoprostol. First of all, we advise being less than 11 weeks after your last menstrual period. In that case, the method is effective at 95%. If your pregnancy is past 11 weeks, you might want to consider another method like vacuum aspiration. Depending on the country you live in, you will be able to find both mifepristone and misoprostol or misoprostol only. You can self-manage your abortion at home. The procedure usually takes between 24 to 48 hours. You should not choose medical abortion if you have had previous allergic reaction to mifepristone or misoprostol, have known or suspected ectopic pregnancy, have inherited porphyria, have chronic adrenal failure. You should be very careful and ask your doctor for advice if you have an intrauterine device, IUD, in place, serious or unstable health problems, including but not limited to hemorrhagic disorders, heart disease, and severe anemia, severe uncontrolled asthma, or long-term corticosteroid therapy. Let's talk about surgical abortion methods. As opposed to medical abortion, you need to go to a health center. Surgical abortion methods are considered as minor procedures practiced by doctors, nurses, or midwives. You cannot do it on your own, and you must make sure to consult a skilled healthcare practitioner. There are two types of safe surgical abortion methods: vacuum aspiration, manual or electrical, and dilation and evacuation. Manual vacuum aspiration, MVA, is the most popular surgical method of abortion for pregnancies up to 14 weeks of gestation. The gestational age limit for MVA often depends on the clinic, as well as the healthcare provider performing the procedure. MVA is performed by a trained healthcare provider in a clinic, usually under local anesthesia. During the procedure, the clinician uses a silent handheld suction device, manual aspirator, to remove the pregnancy from the uterus. The procedure usually takes between 5 to 10 minutes. After the procedure, the recovery time is on average 30 minutes. Some clinics might require that you go home escorted by a friend or relative, but it is not mandatory. While MVA is safe, adverse effects still happen in less than 2% of cases, including heavy bleeding, infection, or injury to the uterus. Electric vacuum aspiration, EVA, is another form of uterine aspiration and is often used on 10 to 15 weeks gestation. It is very similar to MVA, the main difference being the source of the vacuum, an electric machine rather than a manual aspirator. Because the EVA requires electricity, it may not be available in low-resource settings and is noisier. Finally, dilation and evacuation, DNE, is commonly used beyond 14 weeks gestation. The availability of DNE, like other methods, depends on the legislation of the country you live in. It's a minor procedure practiced by a trained healthcare provider, usually under local anesthesia. Prior to the evacuation, your cervix is dilated with the administration of dilation agents, usually several hours or days before. Once dilated, the doctor will evacuate the pregnancy. The procedure generally takes between 10 to 25 minutes. Be careful. Some methods are not safe at all, and they can be very risky for your health. Make sure to choose one of the methods described in this video. Some healthcare providers are not well trained and may propose risky methods like sharp curettage. Please never drink any mixture either, and never try to self-manage your abortion if it's not with misoprostol and/or mifepristone. If you need any more information or if you need advice, there are people and counselors available that can help you choose your option and guide you. For example, you can talk with our friends at safetochoose.org. As you can see, there are several safe options that you can consider if you need an abortion. All of the methods discussed here are safe and effective, but we recommend you talk with a doctor or a trained counselor to choose your best option. In any case, you should use the method that suits you the best. What options are available? How long have I been pregnant? Do I prefer the privacy of doing it myself at home, medical abortion, or do I prefer leaving a clinic knowing I'm no longer pregnant, surgical abortion? Overall, what method is best for me? You are not alone. Millions of women choose abortion, and this is okay. This is your body. This is your choice. Make a safe choice.